Hello, everyone. Good evening from Nigeria, from Lagos, Nigeria, who is watching us today, who is online to join us. Good evening, everyone. Good evening, ATP parents, guardians, and all caregivers. My name is Angela Okomaju, and I will be your moderator on today's episode of ATP Live. Thank you for joining us. We do not take it for granted that you make out time to join us whenever we call, and most importantly, that you are eager to learn. Please invite your friends, share the video, and also understand that you can watch us live on YouTube. Drop your comments in the comment section, your questions there too, and we will read them out when it's time for our professional to give a response. So who do we have online? Kikelomo Oshodi, good evening. Thank you for joining us. Busayo Adeyemo, welcome. Queen D, we're glad to have you join us this evening. So today is Tuesday, and it's the 28th day of July 2020. It is a day set aside annually to mark the World Hepatitis Day. So what other things should we be discussing if not hepatitis today? Okay, so World Hepatitis Day is observed annually every 28th of July to raise awareness about this disease that causes the inflammation of the liver, kills around 1.4 million lives every year. The idea is not to celebrate hepatitis. No, we're not celebrating it. The idea is to mark the date and so that people will understand that this disease is preventable and also treatable. For this year, the theme is Find the Missing Millions. Find the missing millions. There are, all over the world, there are about 290 million people who are living with viral hepatitis, and they are not even aware. So we need to find them and link them to the care that they have so that lives will not be lost. And today, who else that will take this topic but our own family physician, Dr. Rotimi Adesonya. He will be the one teaching us today. Good evening, doctor. Thank you for joining us once again. We appreciate you, sir.
Okay, good evening, Angela, our great moderator. Good evening, everybody at home, all our members all over the world, our volunteers, and all our professionals all over the world. My name is Dr. Rotimi Adesonya. Like she has rightly said, I'm a family physician with some certifications in hepatitis management. So this evening, we'll be talking about management of hepatitis B and the other form of hepatitis. This year's theme was changed at the last minute from finding the missing million to hepatitis-free future. In short, there are recommendations that the WHO released today, which we'll be talking about if the time permits us. Let's start with the definition of hepatitis. Hepatitis is defined as inflammation of the liver. Inflammation of the liver, more or less like an infection or injury to the liver. Inflammation of the liver, that's the meaning of hepatitis. What are the causes? There are different causes of hepatitis, starting from drugs. Some people take some drugs that are toxic to the liver, drugs like overdosage of paracetamol, some drugs like drugs that are used for HIV/AIDS, some TB drugs like isoniazid, and some other herbal medications. That's the first cause of hepatitis. The other cause of hepatitis I will mention is autoimmune disease. There are some diseases of the liver that are from autoimmunity, that the body produces certain, chemicals against the liver. The other cause of liver hepatitis is alcohol intake. Alcohol has been found to be injurious to the liver, and it's one of the causes of liver inflammation, which we call hepatitis. Also, another cause is what you call fatty deposition, what you call fatty liver. Some people have excess fat in the liver. This is also one of the causes of hepatitis. And lastly is the viral hepatitis. The viral hepatitis is classified into 5 different strains. We have hepatitis A, we have hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Viral hepatitis is of public health importance. That's why this evening we'll be playing more emphasis on hepatitis B and C, which are part of the viral hepatitis. It is of public health importance. Hepatitis A and E are acquired through contamination, through unhygienic procedure. Some people that live in riverine area, some after defecating, they may not wash their hands with soap and water. As a result, they transmit the hepatitis A and E. We say the route of transmission is fecal-oral. That means from the feces to the mouth. So that's the causes of those ones. And we don't talk too much about hepatitis A and E because after some times, the body gets rid of them, the person gets well. And for hepatitis B and C, those ones are of public health importance because they have what you call chronicity. They last long. In short, people that are on hepatitis treatment are on the treatment for years. That's why it's of public health importance. I will start with hepatitis B. Well, hepatitis B is the one that is much of public health importance because in Nigeria alone, we have close to 18 million Nigerians, 18 to 20 million Nigerians that are infected with hepatitis B. That means if we take 12 Nigerians, we are likely to have one person that is infected. And because of its chronicity, that means it lasts very long. Some people have been on the treatment for years, as is known globally that there is no cure, but what we do is we do what we call effective treatment. But because of the chronicity, it affects other people in the community. Like if someone is positive to hepatitis B virus, the contacts like the partner and the children are also likely to contact it. We will get there. The hepatitis C is not as common as B, but collectively, hepatitis B and C are caused by infected blood. That's why we need to screen the blood before transfusion in the hospital. It can be acquired through unsterilized instruments that have been used on somebody that is infected can transmit that. Or doing procedure in unhygienic places, procedure like circumcision, like using tattoo, insertion of scarification marks and tattoos. If they are done in unhygienic places, it can be a source of hepatitis B virus. It is also transmitted through sexual intercourse, but that one is a low risk. Then what are the symptoms? The symptoms of hepatitis collectively, collectively, they may have abdominal pain, they may have weakness, they may have yellowness of the eye. But when we come to hepatitis B, which we are going to focus more on this evening, hepatitis B may be asymptomatic. In short, it's asymptomatic in close to 80% of people. What it means is that when you take 8 out of 10 people that have hepatitis B, they may not even have any symptom. So as a result, they will not know whether they are infected or not. But when they start having complication, they may have yellowness of eyes, what we call jaundice in the medical parlance. They may have abdominal pain. Some may have weakness. Some may have abdominal distension, leg swelling. But by that time, they will have started developing a complication before those manifestations, will start coming on. Then if somebody is diagnosed with hepatitis B, the person needs to take the next step, get the contact like the partner, or if it's a pregnant woman, to take the next step by making sure the partner or the offspring is immunized, and once one is diagnosed or once one is detected from incidental finding in the sense that some people, you just tell them to go and donate blood and they find out that they're having hepatitis B. Some, they are in the hospital for other treatment like malaria, and you screen them for hepatitis B, you find out that they are getting positive. So such people are meant to let their partner and their contacts know and take them to the hospital for proper vaccination and also for proper treatment. So the next thing is to talk about the laboratory test. If somebody is infected with hepatitis B or any of the hepatitis, the next thing is to do a liver function test, because the virus lives in the liver and normally cause injury and inflammation to the liver. So they need to do a liver function test. They need to do a lot of viral tests. We call them viral markers, like all those hepatitis B virus antigen, hepatitis B virus antibody, and hepatitis B virus viral load. The truth is that treatment of hepatitis B is very expensive, especially the diagnosis, because you have to do so many tests before the doctor will be able to detect whether the person will need treatment or not. Then hepatitis B treatment is not for everyone. Based on the tests that we do, some may not even need to be treated at all, but they are to be monitored every 6 months or every year in the hospital with the viral load and with their liver function test. But those that need treatment, some may need to be on antiviral drugs for life. So that's why we have challenge with hepatitis B virus, because most of our patients, after some time, it's either they get tired, they don't obey, they don't make up with the adherence, they disappear, only to appear when they are having one symptom or the other. So that's one of the other challenge. Is a chronic case. The treatment is for a long time. So that's what's one of the things that affects our patient. Then the next thing is immunization, vaccination, because it's from the vaccination that the person will get immunized. Most people that are infected, don't even let their partner know, or they let their partner know at a very late time. If somebody is infected and is diagnosed, the next thing is to bring the partner, like I said earlier, bring them for immunization. Children and adults are qualified for immunization. Even women are also qualified for immunization. And the immunization, we have the 3 doses of the immunization. The first one is given, second one is given at a month, and third one is given at 6 months. It is found that those that have the 6 months vaccination, they are not likely to be infected for life, even though there are still tests that they need to do to be sure that they are fully immunized. So now I will go back to the theme for this year. The WHO, like I said, the theme was changed at a very late hour from the finding the missing million to hepatitis-free future. But WHO have designed 5 strategies so that the tomorrow of our young ones, will be better. They will not be infected with hepatitis B, because WHO also have a goal that hepatitis B, C, and the other hepatitis should be eliminated from the surface of the earth by year 2030. So that is a broad goal, that the broad objective or the goal that the World Health Organization is targeting at. So today, just this morning, they released 5 strategies for us to achieve this. That's why they have coined the theme hepatitis-free future. The 5 targets that were released this morning, the first is vaccination. WHO have recommended that every newborn should be immunized with hepatitis B vaccine at birth. And that in the infancy period, infants are children that are less than 1 year, that they must make sure they take the vaccine 3 to 4 times during the infancy period. That's the first strategy that WHO said that we have hepatitis-free future. Then the second one that WHO said is there should be harm reduction. Those people that patronize people that use unsterilized instruments for cutting nails, for barbing our hairs, all other professions that use sharp objects on us, we should try to use new instruments or avoid them. That's the second strategy that the WHO mentioned. Then the third strategy that the WHO mentioned is what we call prevention of mother-to-child transmission, PMTCT. Prevention of mother-to-child transmission. So what WHO is saying is that we should catch the illness early. So WHO is recommending that every antenatal clinic, all our pregnant women should be tested for hepatitis B and C. And those that have hepatitis B, when they get to the third trimester, WHO is recommending that we should do hepatitis B E antigen or the viral load for them. That if their viral load is high, we should start them on prophylactic tenofovir, prophylactic antiviral drugs. That's for pregnant women. WHO just released the recommendation today, even though some centers like the teaching hospitals in Nigeria, they are already doing studies on that and practicing. But WHO recommended that for us. So after once they enter the third trimester, they will use the drug for 13 weeks. That's an antiviral drug, which has been found to be safe in pregnancy, even though it do cross the placenta, but it's safe. It cannot harm the baby. Also, mothers that are infected are expected to have the bad dose of hepatitis B vaccine for their newborn, and also to have hepatitis B immunoglobulin. But the challenge we have in this part of the world is that the immunoglobulin is very expensive. It's very expensive. It's close to hundreds of thousands of naira just to get the child protected. But WHO is even saying that because they know that our own setting is a low resource setting, that we can start the prophylactic antiviral in the third trimester, and as a result, one may not need to use that immunoglobulin. But for those that can still afford it, they can still go ahead and get the immunoglobulin. The other thing that the WHO also said is that we should increase our testing of hepatitis B and C in the hospital, in the community, in the health center, that more people need to be tested for hepatitis B and C. That as a result, we'll be able to pick many more people that are infected that are not known yet. WHO also said that we should follow this acronym of testing, treating, and vaccinating. That you test, if the person needed to be qualified to be part of those that need treatment, they should be treated. And also, those that are negative or contacts of those that are positive, should be vaccinated. Those are the things that the WHO has recommended to us today. There is a guideline to that effect on the prevention of mother-to-child transmission. So coming back to our members out there and all other people that are watching us all over the globe, we take care of the children, and also we have to be conversant of the carrier, which are the mothers. So we encourage the mothers also to get tested even during pregnancy, because some may not give birth in a place that they have such facilities. So they are encouraged to get tested during the pregnancy, and they are encouraged to seek for help if they happen to be infected. They are encouraged to seek for help so that they can start preventing the children they are carrying, even from the womb. So that's the way it will also help us. Then about vaccination. For some of our mothers that are infected, maybe at the antenatal clinic, once it's detected, let's inform our partner, let's bring them to hospital, let them be tested and let them be vaccinated. Even for men that may be watching us out there, if they are also positive, let them get their partner tested. If they are negative, let them also be immunized so that they can be protected for life and they will not have anything to do with hepatitis. I think I will stop here so that I'll be able to take our question. Thank you.
Thank you so much, Dr. Rotimi. I'm wondering why they changed the theme in the very last minute. From fighting the
Yes.
millions to
Hepatitis
um,
free future.
hepatitis-free
Free
future.
future, yes.
All right. Thank you very much. Thank you. I want you to do a recap of the 5 things that WHO brought out this morning. Just a recap of those 5 points again, sir.
Okay, WHO gave us 5 strategies that we need to achieve elimination of viral hepatitis by the year 2030. That's 10 years away from now. The first, the WHO said that we should make sure that there is batch dose of hepatitis B immunization, that every child that is born, immediately they are delivered, the first thing they should do is to give them hepatitis B vaccine, even in the delivery room. WHO actually said in the delivery room, so that because some may be, it may be, they may forget, some may miss the dose, but that's why WHO said it must be in the delivery room. Then the second thing, part of that vaccination, he said the infants, like I said earlier, children that are less than 1 year, they should have 2 to 3 doses of the hepatitis B vaccine, which is already under the national program on immunization. Like in Nigeria, after the batch dose, the children are immunized at 6 weeks, at 10 weeks, and at 14 weeks. And in Nigeria, it doesn't come as a single hepatitis B vaccine, except the one that is given at birth. The other one given at 6 weeks, 10 weeks, and 14 weeks come as what you call pentavalent vaccine. Penta means 5. The experts, the medical expert found out that the amount of needle entering the bodies of our children are too much. So they now decide to combine these 5 vaccines together in one. And the 5 components of the vaccine is, one of them is diphtheria, one is pertussis, and one is tetanus. That's what you call DPT previously, when it was 3. Then later, WHO had hepatitis. WHO now add hepatitis to it, to make it 4, and also add the influenza vaccine to it to make it 5. HIV, we call that one HIV, Haemophilus influenza vaccine, to make it 5. So that pentavalent is given at 6 weeks, 10 weeks, and 14 weeks. It is found out that if a child has the complete 4 doses plus the one at birth, that such children are protected up to 90%, even from hepatitis B virus. So that is one. Then number 2, WHO talks about harm reduction, that we should reduce the amount of places that we visit to use sharp objects, to share sharp objects, to use unsterilized sharp instruments, like some in the hairdressing salon, some in the barbing salon, some in some places that they do tattoos, places where they do circumcisions, and anything involving sharp objects. That's the second one WHO say, harm reduction. Then the third one, WHO said prevention of mother to child transmission, which I've mentioned earlier. That's preventing right from the time the person is pregnant up to 20. If the person is positive at the third trimester is the last 13 weeks of pregnancy, they are meant to go back, to do a viral load, hepatitis B viral load, which is actually expensive. I'm sure you've heard of the amount people do COVID-19 tests, close to 50,000 naira if they have to pay for it. So it's the same technology, the molecular laboratory that is being used for this viral load. So the test is not anything near less than, is around that amount, even though it's subsidized by some NGO in the teaching hospitals, and in some of the government hospitals subsidized by some of the NGO. But what I'm trying to say is that it's quite expensive, that most mothers will not be able to do it. So what part of the things that WHO now recommend today, that instead of that, for those that cannot do viral load, I know what 50,000, what it means to us in this part of the world. For those that cannot afford it, WHO is saying that we should do, there is one that we call hepatitis B E antigen. What this hepatitis B E antigen shows, it shows viral replication. It shows how the virus is multiplying in the person. So WHO is saying that we can do that if we don't have money to do the viral load. But based on the outcome of that, if it is positive, WHO is saying that such women from the 27 weeks, when they will start the third trimester, they should be put on prophylactic antiviral drugs, which we call tenofovir. They should be on it throughout delivery, because it is found out that it will reduce the incidence of hepatitis in the newborn, plus the fact that they also still have to give the bad dose and the rest. So the fourth thing the WHO also said is blood safety. Blood safety. Blood safety means that any blood that has to be transfused must be properly screened, must be double screened. In short, in Lagos State, where I live, there's labs that are accredited by the what we call FEMA, Health Facility Monitoring Agency in Lagos State. So they have to screen the blood like twice. We call it double screen, to be sure there is nothing like hepatitis B or C in the blood, because that's one of the easiest way of getting the virus. So that's the fourth one that WHO said, blood safety. Then the last one is WHO said that we should increase the testing for hepatitis B and C, and also to make sure that we should effect treatment for hepatitis B and C. These are the 5 strategies. With this one, WHO believe that we have hepatitis-free future. Then WHO also believe that by year 2030, we'll be able to eliminate viral hepatitis from the surface of the earth. Thank you.
All right, thank you very much, Doctor. Thank you for explaining that again. Viewers, if you have questions, please drop them in the comment section, and the doctor will be very delighted to answer you. But we don't have any question yet here. While we're waiting, I'd like to ask Doctor, how long does it take before hepatitis B or C affects the liver? I mean, if you wait time, not
okay. Yes. Thank you for that question. I must have missed that at the beginning. For hepatitis B, we have what we call acute hepatitis B and chronic hepatitis B. In short, once one is first infected with hepatitis B, studies shows that after 6 months, it's possible the person immunity will overcome that virus, just like the COVID-19. It's not the cure, but people's immunity are overcoming the virus. So that one, we call it acute hepatitis B. Acute hepatitis B virus. By 6 months, they are out of it. Their body just gets rid of it. But anyone that lasts more than 6 months is said to be chronic hepatitis B. And such ones are the ones that I was mentioning, that we manage them for years, because there is no cure yet. But basically what we do now is we do what we call effective treatment, so that such people will not have liver cancer, liver cirrhosis, which are very deadly. The truth is that people that actually die from hepatitis B and C, they normally die as a result of the complication, which is liver cancer and liver cirrhosis. Thank you.
That's a serious one. All right. Thank you very much, Doctor. Now, for someone, you've discovered that you have this already, what are the things that you need to avoid, until you get properly healed? Dr. Rotimi, are you there?
Yes, I'm here. I can hear you.
Okay. Yeah, I just asked the question. I said, for those who already have this disease, what should they avoid that will help them continue to stay healthy until they are properly healed?
Okay, those that already have the disease, the hepatitis B virus, there are 2 components of the disease, the virus and the liver. So for those that have the chronic hepatitis B, most times the liver is in what we call dormant state. Like maybe in a layman language, I will say the virus is in a dormant stage. It's more or less like the virus is sleeping. Why the liver? Because the liver is carrying the virus as a foreign body, as something strange to the liver will start having some form of injury. So if you do tests and we find that some of those liver enzymes are not okay, we may now have to give somebody restriction. But if the liver is fine, there is no restriction to the types of diets that the person has to take. But for those that already have signs that the liver is going down, high liver enzymes, cirrhosis, some of them, we just look at the function of the liver, what the liver does. Like liver is involved in what we call the amination, breaking down of protein. Liver is involved in cholesterol control and formation. So what we just do in such cases is that we tell such people to try and reduce the amount of protein they are taking, because you don't want the liver to overwork. So you also tell them to control the amount of fat they take, because there's also a condition we call fatty liver, which means that if the cholesterol is high, it may be deposited in part of the liver. We also tell them, to avoid alcohol, because alcohol is normally very injurious to the liver. Anyone with hepatitis B or C or any of the hepatitis and is still dining with alcohol, the person is not doing the best. The person is not friendly with himself or herself. So it's a no-go area once there is a virus in the liver. Alcohol intake is a no-go area. Some also herbal medication. Some herbal medication are so strong because the liver is involved in what we call detoxification. After we have taken food, there are some waste products that the body has to eliminate. That's called detoxification. Liver is one of the major organs in the body. In short, it's the major organs in the body that performs that function. So if you now have something that is strong, like chemicals or herbs, the problem with herbs is that some of the herbs or some of the leaves that are boiled, they have the good parts and the bad parts, which the person will take in. So, but liver that is already challenged to now do the detoxification process, that's like putting strain on the liver. So such people should avoid herbal medication as much as possible. Herbal medications, concussions for whatever reason, local concussions for whatever reason, they should try and avoid it as much as possible.
All right, thank you. Doctor, we have one question here from Fatima Opeyemi Suleiman. She's asking, I have a house help that tested positive to hepatitis B. Is my 6-month-old baby safe around her? My baby is fully immunized.
Okay, thank you very much for the question. In short, I wanted to mention this because what we see in clinical practice at the primary care, because we as medical professionals, we do advise, people that when they get house aid or somebody that we have to assist them in the house, they should get them screened for hepatitis B, hepatitis C, HIV, and some other infectious disease. The basic reason being that it's infectious. But what we normally see, I'm still coming to the question, I just want to lay a foundation. What we normally see is when they bring such house help to the hospital, for some that will test positive, that normally ends such house help or house aid job. But what I just want to say on this forum is that, we should help humanity. If the house help we have is positive, we should try and take them for treatment. In short, the person may be safe if he or she is receiving treatment. I've done all the necessary tests. But yes, thank God that you have immunized your baby. Your baby is fully immunized. But there are some things that you may not get the house help involved. Things that will involve contact with body fluid, because body fluids is one of the way this thing is being transmitted. Things like, if the child vomits, the person has to pack the vomiting, cleaning the child up, because there is nowhere there will be contact. So it's better to be safe as much as possible. But anything that will involve contact with the body fluids of the baby, or like blowing the nose of the child, the nostrils of the child, or anything, or like cleaning the tears from the baby's eyes, because the body fluid is involved, it may be dangerous. So the house help can do so many other things, wash the clothes, do some other things for the baby. But when it involves close contact, there must be caution there. Thank you.
All right, Fatima, I hope you have your question, the answer to your question now. It's a good thing that baby is immunized, but you still have to be very careful so that there's no fluid contact, passing from your nanny to your child. You still need to be very, very careful. I hope you have your answer there now. Please don't forget, if you have questions, please drop them here. We're waiting for you too. Doctor, you mentioned something about people getting tired of taking their medication and then they stop until there is another episode. The medications they are taking, do they have side effects? Why will they stop?
Okay, the truth is that for chronic hepatitis B, the standard is that they are meant to take the antiviral drugs for life. The patients or those that are positive are meant to take the antiviral drugs for life. And these antiviral drugs, the truth also is that there is no drug without side effects. But the ones we use presently, the tenofovir, does not have side effects because it's even safe in pregnant people. But there are some people we don't write it for, like people that are already having kidney problem. But why people normally stop? When something becomes like monotonous from feedback we get from them, when something becomes monotonous, the people may not value it again, because some of them have been using this drug for years, 5 years, 7 years or more. So they stop along the line. Even though if they have to stop, the advice we give them, well, don't ever stop coming to the hospital every 6 months or every year, so that you can get yourself monitored. Because what we are running for is not actually the virus. What we are running for is the complications that I mentioned earlier: liver problem, liver cancer, liver cirrhosis. Because those ones, the mortality is very high. The person may eventually die if the person gets to that stage. That's what actually kills, not the virus. So we encourage them. Then the other part why people also stop may be financial. In Nigeria now, most of our people, they do payment out of pockets. They do payment out of pocket compared to other climes where their insurance that covers treatments, such treatments for people. But because of the pay out of pocket syndrome, there are times that they may be broke, they may not have money to buy the drugs for that particular month. So these are just some of the reasons why the people stop. Then also, some also hear from some other people that professes to be doctors, like herbal doctors, or call themselves different names, that they have cure for the illness. So some of people are fall victim by leaving the hospital to go and patronize those unorthodox practitioners. Thank you.
All right, sir. If I get exposed to the virus, what is the first thing I should do?
Okay, if one has gotten exposed to the virus, as evidence from the test, because it's the test that will actually let you know. So once as one has gotten exposed, the next thing is to try to see a doctor. You can even see your primary care physician, the doctor that is seeing you, who will first give you this first set of counseling, but never accept there is no problem from the first doctor that is seeing you. That first test that one is doing is just the beginning. There are series of tests that the person have done. In short, I must tell you that the liver, being the largest solid organ in the body, performs so many functions. So most of the tests that we do, we have to do tests that we outline that these functions, that the liver is performing these functions well. So they have to do liver function tests. They have to do hepatitis B viral load. They have to do hepatitis B panel, which we call the hepatitis B viral markers. Also, we need to do sugar tests for them to be sure they don't have diabetes, because the liver, one of the functions of the liver is also to control the sugar intake. When we take excess sugar, the liver converts it to glycogen and is stored in the body. So we also have to check their sugar. We have to check their cholesterol level. I must tell you, during the process of treating such people, by the time we are doing this test, we pick all these other things. Some may also have diabetes along the line. Some may also have high cholesterol along the line, which are also the things that we do treat. Then the next thing the person also has to do is what we call abdominal scan. The abdominal scan will show how the liver is, whether the liver is enlarged, whether the liver is even having all these complications that I've been mentioning, like liver cirrhosis. Liver cirrhosis, like the liver is a very smooth organ, but if there is cirrhosis, liver become like is having boil. There are boys on the liver. But those ones are normally picked by the scan. Also, what we call fatty liver, the scan will pick it. So that's why they also have to do abdominal scan as part of the test that they have to do. There is also what we call alpha fetoprotein. The alpha fetoprotein is a marker for liver cancer. So we do all these tests to be sure that the person is safe. But you can see why these tests are so expensive. And most times, the insurance scheme may not cover all these tests. So these are the tests that they need to do for one to be able to say you need treatment, you don't need treatment, this is the level, is acute or is chronic, or the person is already developing complications. So these are the things that we do.
All right, sir. When the liver gets infected, does it always end up in cancer?
Yes, when the liver gets infected, in short, the liver is like is one organ that does not complain on time. The liver have the capacity to absorb. That's why most of our patients who have hepatitis B, they are asymptomatic. They don't have symptoms because the liver, even though it's harboring the virus, but the liver is accommodating it unto the point whereby there will be injury from the response from the liver. So the liver accommodates all this. Sorry, help me rephrase the question again so that I will.
I was asking if once the liver gets infected, does it always end up in a cancer?
Okay, once the liver gets infected, does it always end in cancer?
End up in cancer, yes. Okay.
No. There are different stages. That's what you call fibrosis. That means the liver is changing from the smooth texture to something firm. And that before the cirrhosis I mentioned earlier, then before the stage of liver cancer. But not all of them will end with liver cancer. And if it's at the early stage, like the fibrosis, the person have to be using the drug. Even that cirrhosis we mentioned, they have to use the antiviral drug for life. As a result, they'll be able to reverse the trend, or they will not even be able to get to the end stage. But the thing is that if the person defaults and is not using the drug, it may end up with the liver cancer. So not everyone that is infected get to the stage of liver cancer, but they can only know if they go to the hospital and get tested. Then one other thing I must say, once they have already seen that their eye is getting yellow, which we call jaundice, or their abdomen is protruding, or their leg is getting swollen, they are getting tired, complication might have already started setting in. So at that point, they have to go to the hospital so that whatever they are going through can be detected early. Because it's when it is detected early that the doctor will be able to help the person.
All right, so Mikey Wally is asking, are cold sores hepatitis?
No, cold sores are not hepatitis, but cold sores are also viral infections. They are called herpes. They are caused by herpes virus. They are caused by herpes virus. So that's cold sore, which some people call fever blisters. So they are called by herpes virus. It's another form of virus, but not hepatitis B virus or hepatitis C virus. It's caused by herpes virus. That's the name of the virus that causes that, herpes simplex virus.
Okay, Mike, I hope you have...
HSV, that's the abbreviation for that.
Okay.
Like, hepatitis B is HBV, hepatitis B virus. But the one that causes the cold sore is HSV, herpes simplex virus. So
Okay.
also that one also does not really have treatment, but it's mild. The body recover from it. There are some viral illness like common cold that we normally have. People do recover from them without any treatment. In short, when we see patients with cold, it's not the cold we are treating. We are just giving them drugs so that they will not have drugs to suppress other symptoms like headache, fever, and the rest. So the cold goes on its own by the immunity of the person. So some viral illness goes on their own, just like this cold sores that Mickey mentioned.
Okay, Mikey, I hope you have your answer there. That's what is caused by herpes. This one is different. We're discussing hepatitis today. So they are different things. So, doctor, when you were talking, you said something about out of every 12 Nigerians, right?
Yes.
Or 12 in the world, one person has got this virus.
Yes, the prevalence in Nigeria is 8 to
Yeah.
10%. And it is studies have shown that between 18 to 20 million Nigeria, their population is estimated to be 200 million. So if
200.
20, yes, if 18 million or 20 million are infected, that's like 1/10. So, but the studies, it varies from center to center, but on the average, 1 in every 12 Nigeria is infected with hepatitis B virus. But they will not know unless the person go to the hospital to get tested, because it's normally asymptomatic.
Okay. Do we have any other question? No. Did you already answer
Okay.
this question? Yeah. If someone has it in the family, should the others be scared?
Yeah, if someone has it in the family, the first step the others have to take is to carry everybody to go and get tested. So if all the other contacts and the partner, if they are negative, then the next thing is for them to have full immunization, which means they are protected for life. But if they are not vaccinated, especially the partner, who normally have exchange of body fluids, who normally have exchange of body fluid, is at high risk. It will get to a time that the person, may be infected depending on the immunity of the person. So there is no need to fear. If one person in the family is infected, carry all the family members to the hospital or to the laboratory and get them tested first. If they are all negative, get them vaccinated. As a result of that, one can go back and sleep, that there is no problem.
Okay, now, if we are truly aiming for a hepatitis-free future and these tests are still very expensive, how are we going to get to that?
Yes, in short, that's what part of the stakeholders are doing now, to make a formidable presentation to the Federal Ministry of Health that the same way they have been supporting HIV/AIDS treatment and diagnosis, that they should extend it to hepatitis B virus treatment and diagnosis. For people that have HIV/AIDS, they used to have their tests done for free. At a point in time, they used to have their drugs given to them for free, even though those things are donated by donor agencies. So they used to get these things easily done for free. They can easily go to the lab. So the stakeholders are making presentation to the federal government that they should extend such to the hepatitis B virus treatment, vaccination, even though for now the children under the public sector have free vaccination, but this is not extended to the adults. The adults don't have that luxury. So most of the adults have to go to private places, to get vaccinated, which is even one of the reasons that is making the partners of those that are infected, also to get infected, because they cannot easily assess where they will get to be immunized. So the stakeholders they are meeting with the federal government, to give them a formidable presentation that they need to extend, including funding. In short, WHO also mentioned that funding, including funding from the federal government, the vaccination should be extended to the adults, and health education at all levels. I will tell you, there is one statistics I didn't mention. Out of people that are infected with hepatitis B all over the world, we have 250 million people that are infected with hepatitis B virus. But studies shows that it's only 10% of them that knows that they are infected and are receiving treatment. The other 90%, they don't even know because they don't know and they are not receiving treatment. So what the health education has to be increased. It has to be carried to our churches, it has to be carried to the mosques, carried to the markets, carried to the communities, carried to the for community outreaches, carried to the schools too, because young adults also do get infected. So the health education should be carried to the schools. The health education should be on the media, should be sponsored, like the way we did when it was the time for HIV, the way it was sponsored. And also, our artisans should not be left out. People that are into hairdressing, barbing, and other people that use sharp objects, they should be carried along, and they should also, this health education should be extended to them that they will know. Thank you.
All right. I have another question. Do you recommend self-isolation if a partner gets this? Husband and wife, one of them gets it.
Yes, for hepatitis B virus, even though one of the mode of transmission is through sexual intercourse, in short, is somehow classified as part of sexually transmitted disease. That's hepatitis B virus. So there are ways that you can prevent that, not total isolation. That's what we call, well, for those that are not yet married, they should abstain from having sexual intercourse, or if they have to do, they will need to use a condom to get themselves protected. And those are in that have multiple partners, they also need to get themselves protected. So there is no need for isolation. Instead of isolation, what they need to do is vaccination. Vaccination and not isolation is what the contact of such people will need to do.
For adults who want to take the vaccine, do you think they should get tested first before they take the vaccine?
Yes. In short, the truth is that before you get the vaccine, you must be tested to be sure that you are negative. Because in the past, some people have been vaccinated and they will come back to claim that it's the vaccine. But the hepatitis B vaccine is actually genetically modified. It's what was formed from what you call DNA recombinant gene. It's genetically modified. It's not really direct plasma of infected people. So some have come back to say it's a vaccine that got them infected. So as a result, we must make sure we test everyone before vaccinating. And if they are positive, they don't need the vaccine. The vaccine will just be a waste. So that's one of the reasons. Instead of wasting the vaccine, you test the person is positive, you refer the person for treatment. So everyone, before being vaccinated, before they get vaccinated, they must be tested.
All right. Thank you very much, Doctor. Thank you so much. For everyone who is watching or listening, our take home today should be the 5 new points that the doctor said what WHO released today, and that's to vaccination. That was the first point, and he said something about using unsterilized sharp objects.
Yes, and that's harmful reduction.
Yeah, and then
reduction.
All right. And then you also said prevention of mother-to-child transmission.
Yes. Then blood safety.
Then blood safety. Yeah. And then also said increased testing of hepatitis in communities.
And C.
In communities. All right. Thank you so much. Thank you. Thank you, everyone, for staying with us through this. I hope you learned a thing or two. Thank you for your comments. Thank you for your questions. If you have any questions again to ask after now, just drop them and either the moderators or the professionals will get to it. Doctor, any last word for us?
Okay, well, the last word, what I will say is that hepatitis B virus and hepatitis C, they are largely preventable. In short, all the viral hepatitis are largely preventable. Now we are all doing hand washing because of coronavirus. It will also protect against hepatitis A and E. Even after COVID-19, pandemic has gone, we need to continue it because we don't want to get infected with hepatitis A and E. And for the hepatitis B and C, we should make sure we avoid having contact with those that having sexual contact with those already positive without being vaccinated. Or if one has to do that, they have to get themselves protected so that they will not be victim of the virus. Then also, when we go to hospital, we can also ask the professional whether the blood is clean. You are meant to see the logo that the blood are actually screened. So we should watch the blood that we also receive in the hospital. So I believe with all this, we'll be able to together collectively as a group and community and our nation, we'll be able to meet the target of WHO, which says that hepatitis-free future and also eliminating viral hepatitis by the year 2030. Thank you.
All right. And from me, everyone who is watching, remember to have a world without hepatitis. We need to do our own part in our own small ways. And we also to know to get tested and do the right thing if you know that you have it, and then it gets treated. To you, Dr. Rotimi, and to everyone who watching us, who has commented, was asked a question. Thank you very much, and have a very good evening.
Thank
Bye.
you. Have a great time.
All right. Bye-bye, sir. Bye. Bye, everyone.